All right, welcome back to ABA exam review and the continuation of our BCBA practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout-out. Work hard, study hard. Let's get going. A vocational program teaches a multi-step job task. 1. Gather materials. 2. Assemble components. 3. Quality checking. And 4. Packaging. Each step is reinforced with a check mark on a task card, and only after completing all 4 steps does the client receive a token exchangeable for break time. Initially, the client completes all steps fluently, but after several weeks, performance deteriorates, specifically on steps 2 and 3, while steps 1 and 4 remain strong. What characteristic of chain schedules does this pattern most reflect? So we're starting with the long question, but our strategy doesn't change. We figure out what the question is asking, and then we attack the question first. So the question wants to know, what characteristic of the chain schedule does the pattern reflect? When we think about chain schedules, we think about multiple basic reinforcement schedules, one after another, until we reach that terminal reinforcement. In this case, each step in this chain is reinforced by a check mark, and only after the chain is done, all 4 steps, does the client get the token. Pretty straightforward. However, at this point, steps 2 and 3 are now an issue with performance, while 1 and 4 remain strong. So what might be the problem? What characteristic might we want to examine for this schedule? A, this reflects ratio strain from the FR4 requirement. Well, a couple different things for A. One, they are still getting a reinforcement check mark for one response, right? So the token is FR4 because they have to do 4 responses, but each step gets its own reinforcement. And with ratio strain, the attempts and the responding would likely go down. The problem here is the performance on steps 2 and 3, not necessarily the responding. B, this reflects weak condition reinforcement in the middle links. A common issue with chain schedules, especially as they get longer, is the condition reinforcement for the middle steps is often worse than the beginning or the end. With the beginning, it's that initial surge of reinforcement. With the end, now we have escape and we're through with the chain. But once we get to the middle, sometimes the conditioned reinforcement is not as strong. So if we're specifically struggling in the middle on a chain schedule, we want to look at the conditioned reinforcement. C, this reflects an establishing operation effect. Well, with an establishing operation effect, there's usually a temporary increase in behavior because the reinforcement is more valuable. Here, we're having an issue with performance. It does not necessarily reflect an establishing operation. D, this reflects stimulus control issues for the first step. The first step is not the problem. Step 1 is strong. Step 4 is strong. The problems are step 2 and 3. And when our middle steps for a chain schedule are the issue, we first want to look at how strong the reinforcement or condition reinforcement is for those steps. The client engages in screaming, hitting, property destruction that all result in escape from demands. The behavior analyst successfully teaches the client to request breaks appropriately and all problem behaviors decrease. However, after 2 weeks, property destruction reemerges specifically during difficult math tasks, but not during other activities, while the other problem behaviors remain low across all contexts. What does this pattern suggest, and what should the next intervention step be? All right, another long question, same approach. What does the question want to know? It wants to know about the pattern and what we should do next. So we're not jumping to the answer choices. Let's attack and gather information. We know the client is engaging in these behaviors that result in escape from demands, right? So if the client wants to meet the function of escape, they will engage in screaming, hitting, and property destruction. The client is taught to request breaks, and these problems decrease. But after 2 weeks, property destruction reemerges during difficult math tasks, but not during other activities, and everything else is low. So the behavior's changed. It's all decreased in all activities except for math tasks. Now, what does that suggest, and what should we do next? A, property destruction was not part of the same response class. Well, let's stop there because from the beginning, all 3 of these are leading to escape. So there's no reason now to think it wasn't part of the same response class as hitting or property destruction. A does not fit. B, stimulus control has developed where math tasks signal extinction for break requests. Ensure break requests are honored during math. Certainly possible. We don't know exactly how many activities or what's going on, but if everywhere else the behavior has remained low and where we want it to be, and only during math is property destruction up, well, it's potentially that the client who was taught to request breaks instead now sees math and thinks, well, I'm not going to get my break request. That's certainly possible. So we would need to make sure those requests are honored during math. B looks pretty good. C, an abolishing operation has developed for break requests during math, increased break duration for math tasks. Not necessarily. The client still would want to get out of the task because the property destruction led to escape. So when a behavior comes back, it's typically still meeting the same function. So C, with more information, we might get closer to C, but B is still better. D, discrimination training was too effective. Implement generalization programming across all types. Well, we can stop here. Discrimination training was too effective. We weren't teaching them to discriminate for anything. We were teaching them this replacement behavior. The problem developed typically, or what we would expect based on this information, that math is now signaling either extinction for break, or when they see math, they know they're not going to get reinforced for escape from the problem behavior. But if we've already decreased the response class and a response has come back from the response class, then something has changed where the alternative behavior is likely no longer receiving reinforcement. So we've got to go back to reinforcing break request. During a conversation, a child sees a fire truck, hears a siren, and then says fire truck while pointing at it. Later, when asked what vehicle puts out fires, the child again says fire truck. In this first instance, which verbal operands are operating under multiple control? Pretty straightforward question. We're looking at the first instance and what operands are operating under multiple control. So the first instance is what? Well, the child sees a truck, hears a siren, says fire truck while pointing at it. So the child has done what? Well, they've tacted the fire truck. Why? Well, likely because they saw the fire truck and maybe also because they heard the siren. So that tact could be controlled by either one. So if you look at A, tact, a visual stimulus, yes, likely the fire truck, and echoic, the auditory stimulus from siren. The child did not copy the auditory stimulus from the siren. They labeled the truck. So A is out. B, tact, a visual stimulus, and intraverbal, auditory stimulus from siren. Well, the intraverbal is not being, well, the child is not engaging in intraverbal with the siren. He's labeling the fire truck due to this nonverbal stimulus. C, tact, visual and auditory stimuli. Yes, potentially some echoic control if others said fire truck. Sure. Now, that keyword is potentially, because we don't know, but there's definitely a possibility. And then D, man, wanting attention to the fire truck and tact. A man, you're reinforced with what? With what you requested. The child was not necessarily given the fire truck, or we don't know if the attention was paid to the fire truck. We just know the child tacted the fire truck. So the closest answer would be tact, visual, and auditory stimuli, because that is most complete. Your technician is implementing a token economy with a 9-year-old client who earns stars for completing tasks. The client has earned 9 out of 10 required stars to exchange for iPad time. There is no response cost in place. Suddenly, the client throws all the materials and refuses to continue working. The client's mother, who is observing, suggests you give the client the iPad anyway, since they were so close to earning it and they've worked enough. The technician asks how they should proceed. What is the best answer? So you are in the supervisor role, and you've got to advise the technician in this situation. We have a token economy, stars for completing tasks. We are 9 out of 10 stars to exchange, so we're very close. No response cost, meaning we're not taking stars away. But the client throws all the materials and stops working. So we're 1 star away, no response cost in place. The client's mother says now, just give them the iPad, they're so close. The technician wants to know, what should we do? Well, what do we do? How do you respond? A, tell the technician to identify if the client is satiated on work, and stop if they are and discuss with the parent. What's the issue with trying to identify if a client is satiated on work? Well, how do we objectively measure satiation? If you ask a lot of kids if they don't want to work and they're tired of working, they're going to say yes in a lot of cases. Asking the technician to make that subjective call and stop if they are is not very behavior analytic. B, the technician should restart the token board from 0 tokens. Well, we know there's no response cost in place, so that's likely not going to be the best way to respond, given that's not the plan. C, tell the technician to inform the mom she can no longer be a part of session. If you want to make the judgment call as the BCBA, then you need to make that call and discuss it with the mom. That is not the technician's job. Do not send your technician to have conversations that you should be having as the BCBA. D, suggest that the technician continue the treatment plan as written and discuss with the parent. Yep, parsimony. Simplest, most obvious explanation, continue your treatment plan. If you need to adjust, do it after we're done here. But the client should be aware of what's happening. You shouldn't just change the treatment plan without letting the client know. If the client knows, or the client is supposed to get stars, and there's no response cost, and they need one more, changing it up on them like B and going back to 0, well, that's springing it on them without any input and letting them know, which is unethical and it's not something we should be doing. So we have to continue this plan, at least finish out this trial or whatever you want to call it, discuss with the parent, and then after everything is finished, they've earned a 10, then maybe if you want, make adjustments or change it up or keep it the same and see how it goes. You're at a coffee shop studying for an exam when you run into an old friend. Your friend notices your supervisor folder and asks what you do for work. You explain that you work with children with autism and supervise technicians. Your friend then asks, oh, do you know the Smith family? Your son has autism and I heard he goes to therapy at your clinic. What is the most appropriate response? So if you are in public, one, we need to make sure all our information is confidential, right? So seeing that you're a BCBA because you have a folder is not necessarily violating confidentiality, but be sure you don't have any information that people can come up and read or see. 2, yes, there's nothing wrong with saying what you do, but if someone is asking specifically about somebody at your therapy clinic, how do you respond to that? A, confirm whether the child goes to the clinic so your friend has accurate information. We should give no information, either yes or no, any information about who is at the clinic. B, neither confirm nor deny the client is part of your clinic. We don't want to give anything about who goes to the clinic. It's not this person's business. We have HIPAA, we have ethics, we have our privacy rules and policies. Don't give them any information about who does what at your clinic. C, say you don't know the client even though you do work with them. We don't want to lie either because our ethics code says we're honest as behavior analysts in public statements. D, provide a way for your friend to contact your clinic if they'd like to know this information. Well, no, you should not just give out a way to find out private information. If this person knows the Smith family, they can go talk to the Smith family. It's not your place. It's not the time to give out this type of information to anybody who's not part of the team or you know for a fact has a right to that information. So you're neither going to confirm nor deny the client is part of your clinic. Thanks for watching. Check out behavioranalyststudy.com. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.